Hello everyone, welcome to this virtual session produced by the Hello Baby team on pain relief for labour and birth. To begin with, I'd like you to have a little think about what you would like to gain from today's session. This session is going to cover the difference between non-pharmacological pain relief methods and pharmacological pain relief methods. We will discuss the benefits and the risks of each type of pain relief. We'll discuss where you can have this and when in your labour you can have this. And then to end with, we're going to talk a little bit about the brain tool and some additional resources you can look at after this session to help you with your decision making about pain relief in labour. So what is the difference between non-pharmacological and pharmacological? Non-pharmacological pain relief simply means pain relief without medication. Therefore, pharmacological pain relief means pain relief with medication. So let's look at some non-pharmacological pain relief methods. So first up we have TENS machine. TENS stands for transcutaneous electrical nerve stimulation. TENS can be used to relieve pain through the use of mild electrical impulses. How it works is that you self-apply pads to your back, and then you have a little remote control which you can use to press a button when you feel your contraction come in, and that sends little impulses to your back. If you want to use a TENS machine, you would need to borrow this from a friend or family member, or hire or buy one, as we don't have them for use at the hospital. The good thing about a TENS machine is you can use it at any point during your labour. It's most commonly used in the early or latent phase of labour. Where can you use it? So you can use it at home, on the antenatal ward, on our birth centre and delivery suite. Some benefits of TENS machine are: it provides immediate relief of pain or distraction and also wears off quite quickly, so if you don't like it you can just stop pressing your button. Like I say, you're in complete control of how and when you use it. There is no known harmful effects to your baby. You can use it at any location, you can take it off if you don't like it, and it's really quick to apply. Some risks associated with a TENS machine is that it might only provide you mild pain relief, or more like a distraction from your contraction pain. It may not be as effective in the second stage of your labour, so as your labour progresses towards the end. And if you want to use it, you have to plan to use it, as you would need to pre-arrange this before coming to hospital or having your home birth. Next we have the use of water, also known as hydrotherapy. So the use of warm water can provide comfort and relaxation during your labour and birth. This can be provided in the form of a shower or the use of our birthing pools, or simply just a bath filled with warm water at home. You can labour and birth in water, and you can choose to get in and out of it as freely as you want. This can be used at any point in your labour, which is really good. We do recommend using the birthing pools though during your active phase of labour. Where can you use it? So you can use this at home or on our birth centre. Each birth centre room has its own pool. We do have one room on delivery suite which has a pool in it, which has a waterproof telemetry continuous monitoring machine to monitor your baby's heartbeat. Some benefits is that it provides immediate relief. Research has shown it can provide relaxation, ease painful contractions, shorten your labour and reduce the chance of needing intervention in your labour. You can use it at home, particularly in the early or latent phase of labour, and if you're planning a home birth you can hire a birthing pool. The home birth team can give you more information on this. Some risks associated with using water is that you have to carefully monitor the temperature to reduce the risk of you and your baby getting hypothermia or hyperthermia, so if your temperature went too low or too high. The birthing pools can take 30 to 40 minutes to fill up. So sometimes it means that you have to wait a little bit, but if you're coming to hospital, it's always worth calling the triage line so that we know you're on your way and we can prepare a midwife and prepare a room for you. If unexpected complications arise while you're in the water, please be aware that this can cause a delay in treatment due to the time taken to get out of the birthing pool, but the midwife caring for you in this moment would obviously spoken to you about this and will support you to get in and out of the pool as needed. Next up for our non-medication based pain relief methods are the group of alternative therapies. This includes things such as acupuncture, acupressure, aromatherapy, massage, hypnobirthing, and breathing techniques. These therapies are not routinely offered on the NHS, so you would have to privately arrange these, attend some antenatal classes, and learn how to incorporate these into your labour and birth. But please do check with your lead community midwife to see if they're suitable for you first. You can use these at any point during your labour and birth, depending on the therapy you choose. But they're also really good for using during later pregnancy and also the postnatal period to keep you calm, relaxed, and feeling still in control. You can use these at any location, either at your home or in hospital, but it's important to seek advice from a person trained in these therapies prior to using them. Some benefits can include they can relieve pain as soon as the therapy starts. Some research has shown that these types of complementary therapies can help women and birthing people feel more in control during their labour and birth, ultimately leading to a more positive experience. They can help improve relaxation and comfort during contractions. The risks associated with these therapies are that there is limited evidence on the effectiveness of these types of therapies. Therefore, they're not freely available on the NHS, so you would have to organise or bring your own to use. Now we're going to move on to our pharmacological pain relief. So that's our pain relief that involves medications. When thinking about our pharmacological pain relief methods, I would always suggest starting with the bottom of the ladder and working your way up. If you wonder what I mean by that, if you think about our pain relief with medication as a ladder, we start off the bottom of the ladder, try that thing. If that doesn't work, then you go up to the next step. If that doesn't work, then you go up to the next step. If you go into the most top effective pain relief method at the top of the ladder and that's not working for you, you have nowhere else to go up the ladder. So I always suggest starting off the bottom of the ladder and working your way up and finding what's right for you. Everyone is different, everyone will handle their labour and birth different, so you've just got to find what's right for you. But at the bottom of our pain relief with medication ladder is our paracetamol. Paracetamol is an oral medication commonly used for pain relief and can be taken to relieve pains and aches. You might have used this in your pregnancy, it's completely safe to use, or you might have used it usually pre-pregnant life. How do you use this? So you take it orally as a small tablet or 2 tablets or as a liquid form. You can buy this over the counter so it does not require a prescription. The max dosage that you should have is 4 grams in 24 hours. So that means 2 tablets which make up 1 gram at least 4 hours apart. When can you use this? So you can use this the whole way throughout your labour, however it's most effective in early labour. Where can you use it? So you can use it at home as it does not require a prescription, on our antenatal ward, on our birth centre or delivery suite. The benefits of paracetamol include it provides effective short-term relief of pain during early labour, particularly for backaches, and can relieve your pain for around 3 to 4 hours. It's taken orally, so it does not require an injection, and this might be a benefit to some. And you can take this medication in conjunction with other pain relief methods, as well as using it whilst you're in the birthing pool, so using water. Paracetamol very rarely causes side effects, but there are some risks associated with it if you don't take the right dosage. It may feel ineffective as your labour progresses, but it's really important, like I say, not to exceed the recommended daily dose. If you do that, then that's when complications can arise. Next up the ladder we have codeine phosphate, also known just as codeine. Codeine is a type of oral medication that belongs to the opioid family. It works really well when taken with paracetamol and can be used to relieve pains and aches. This medication is taken as orally as small tablets. The medication requires a prescription from a doctor. Dosage can range between 30 to 60 milligrams, so 1 or 2 tablets. You can use this throughout your labour, however, is most effective in early labour. Where can you use it? So if you're planning a home birth, you could get a prescription from your GP ahead of having your baby, so you can use it at home. Or you can use it on our antenatal wards, our birth centre or delivery suite if you come into hospital. The benefits of codeine are that it provides effective short-term relief of pain, particularly during your early labour, and is particularly useful for backaches, very similarly to paracetamol. Like I say, it's taken orally, so it does not require an injection, which can be a benefit to some. And you can take this medication in conjunction with other medications, as well as using the water, so you can get into our birthing pool. It provides relief of pain for around 3 to 4 hours. Risks associated with codeine. So as it forms part of the opioid family, it has similar side effects to other opioids, which include nausea, vomiting, or constipation if you have prolonged use. It may feel ineffective as your labour progresses, and a bit like paracetamol, it's really important not to exceed the recommended daily dosage, which is up to 60 milligrams, which is 2 tablets, 3 times a day. If you exceed this, that's when complications can occur. Next up we have oral morph, also known as oral morphine or liquid morphine. This is a liquid morphine solution that can be used in early labour only to help relieve pain. This medication is taken orally through a syringe when it's drawn up out the bottle and requires a prescription from a doctor. This medication is only licensed for early labour, so your latent phase. You can use this on our antenatal ward, birth centre and delivery suite. It's not available for having at home. The benefits are, if you wish, you can have this medication in early labour if you come in for a labour assessment at the hospital. If you're not quite in established labour, you can have this and then go home again, if that's what you would like. The medication can be used in combination with other medications such as paracetamol and codeine, and you can also use it whilst in the pool. It is taken orally, so it does not require an injection, so you just have to swallow it, and it takes about 15 minutes to work. Some risks are, like I say, as it's part of the opioid family, it can cause drowsiness, nausea, vomiting or constipation. It provides short-term relief of pain for a couple of hours. And because it may cause you to feel a bit drowsy, it might cause your baby to feel a little bit drowsy. And sometimes this can cause possible delays in establishing breastfeeding if it's given too close to birth. Although this is less than if we had pethidine, which we will talk about in a couple of slides. When given at the right time, so in your early labour, this will have less effect on your baby. But obviously it's hard to predict when these babies will come, so sometimes they do come a little bit quicker and then are therefore a bit drowsy. But if given in that early labour, there is enough time for it to wear off your system, so 2 to 4 hours before your baby is born. Next up the ladder is Entonox. Entonox is also known as gas and air. It's a mixture of nitrous oxide and oxygen which is used to relieve pain. It is a gas that you breathe in via a mouthpiece and breathe out via the mouthpiece during a contraction until the end of the contraction. It is completely safe to use this at any point during your labour, most commonly used in active labour. If you are planning a home birth, this is something the home birth midwives would bring with them, and plenty of it. And you can also use this on our birth centre and our delivery suite. The benefits of gas and air is that it provides immediate relief of pain, but also wears off quite quickly, so it only lasts in your system about 30 to 60 seconds. You are in complete control of how much you use because you are the one breathing it in and out from the mouthpiece, from the beginning to the end of your contraction. It has no known harmful effects on your baby, and it will help you feel more relaxed but not take away your pain completely. You can use this at any point during your labour. The risks are, even though it helps makes you feel relaxed, it does not take your pain away completely, and it's fairly short acting. It can make you feel quite dizzy or lightheaded or quite sleepy, and you may feel a little bit nauseous, and this can cause some vomiting. However, this is also common in active labour anyway. It may cause you to have some dry mouths or dry lips, so drink plenty of water and bring some lip balm if you're planning to use gas and air. Next up the ladder is pethidine. Pethidine is a type of opioid injection given to relieve pain. It is given via an intramuscular injection, which means it goes into the muscle, either in your arm or your leg. It is always given with an anti-sickness medication combined in the same syringe. You can use this in both your latent phase and active phase of labour. However, it's commonly not advised near the end of labour if your birth is imminent. You can use this on our antenatal ward, our birth centre and delivery suite. It is not available at home. The benefits of pethidine include: it can make you feel more relaxed during your contractions and allow you to rest in between these contractions. It provides relief of pain from around 2 to 4 hours. You could still use the birthing pool, but just after the 4-hour mark, usually, because it can make you feel a little bit sleepy, so we wouldn't want you to feel sleepy and in the pool. But obviously this is recommended on an individual basis. So, some of the risks associated with pethidine. Like I was saying, it often makes you feel sleepy, drowsiness, because it's part of the opioid family, which can also cause nausea and vomiting. But that's why we give it to you with an anti-sickness. It takes about 30 minutes to have a full effect. And because, similarly to the oral morphine, it may cause drowsiness in yourself, it therefore may cause drowsiness in your baby, which can often lead to possible delays in establishing breastfeeding, if given too close to birth. Pethidine is a really good pain relief method, but most people have reservations about it. And this is what I mean by saying if given too close to birth. A bit like the oral morphine, if you have a conversation with the midwife that's caring for you and you have this at the right time in your labour, then often it is out of your system by the time your baby is born. But obviously, if given too close to birth, which is sometimes unpredictable, this is when these can have these side effects. So we're at the top of our ladder now, and the top of the pain relief ladder is epidural. Epidural is local anaesthetic that is given through a fine tube catheter in your back to numb your pain. When I say tube, I mean a tube that is a couple millimetres thick. It is really, really small. How do you use it? So an anaesthetist sites the epidural during a sterile, aseptic procedure, which takes around 20 to 30 minutes. You have a continuous flow of medication, as well as a PCA, which is a patient-controlled analgesia pump for top-ups. So you have a continuous flow running from the pump that goes through the tube, and you have a little button which you can press for top-ups if you need an extra boost of the epidural mix. When can you have it? So an epidural can be sited again at any point during your labour, however, it's most commonly used and advised in active labour. Where can you use it? This is only available in delivery suite or in our theatre department, as we need to monitor you and your baby a lot closely. Benefits of an epidural include: epidurals can be the most effective method of pain relief in your labour if they are sited correctly. You will continue to feel pressure and touch. You'll still be able to move your legs. You might even be able to stand. We have mobile epidural mixes, but this is different for everyone. The more you press your top-up button, the denser the epidural block may become and the less mobile you may feel. So you might not be able to stand in these cases. But this is all done on an individual basis. You can start to feel the epidural working and the benefits from this after about 20 minutes. If it's sited correctly, it will allow you to feel relaxed, not feel your contractions, and provide you the opportunity to rest or to sleep. We call it the epidural sleep. Everyone loves it. It does not make you feel drowsy or nauseous as well. So some risks associated with this. So we were talking about wanting to monitor you really closely. This is because it can often cause a drop in your blood pressure because you're so relaxed. but that could in turn affect your baby's heartbeat if it's not treated. So we monitor your blood pressure every 5 minutes for the first sort of 20 to 30 minutes, and then after that we do it every half an hour. So we would be catching your blood pressure if it starts to drop. You will need a cannula inserted to your hand and a catheter inserted into your urethra, so where you go for a wee, if you are unable to stand and mobilise to the toilet. This may also increase the need for an instrumental birth, so an epidural might increase the need for an instrumental birth with forceps or ventouse. There is also some other risks that you will be informed about if you're making the decision to have an epidural from the anaesthetist. Some of them include bad headaches postnatally is about 1 in 100, temporary nerve damage which is 1 in 1,000, and permanent nerve damage which is 1 in 13,000. They will give you a sheet of a laminated card, and this will have all of the stats and the statistics to do with epidural risks on that. Please don't be scared by this information, but it's things that you must know. So I'm trying to introduce some of those facts now so that you have those to process. This slide takes you to a really useful website called Labour Pains, and on this website they have a video of an epidural being cited, and if you're thinking about having an epidural, it's a really good thing to watch just to be fully informed. It's not a scary video, I promise, but it's just really informative. So if you're thinking about maybe opting for an epidural, please have a look. So the last pain relief method to talk about is remifentanil. So remifentanil is somewhat at the top of the ladder, however not as effective as an epidural. But not everyone is always suitable for an epidural. Maybe those who've had spinal surgery or have severe scoliosis would not be suitable for an epidural, but that is something that you would know antenatally in your pregnancy, and you would have been referred to our anaesthetist to have counselling on your options if you wanted different types of pain relief methods. So remifentanil provides an option for those who cannot have an epidural, but it has its own risks associated, which we'll discuss. Remifentanil is a patient-controlled analgesia, so another form of PCA, and it's a type of opioid which can be given if you cannot have an epidural for medical reasons. So how is it used? So a cannula is inserted into your hand, the medication is given through a drip, and you have a button to press when you require the pain relief, so you'd have to press it with every contraction that you have. You can have this at any point during a labour, but most commonly advised in active labour, and it's only available on delivery suite or in theatre, as you would need to be closely monitored. So the benefits are that it can be used in combination with gas and air, like any of the other pain relief methods. I forgot to add that you can use gas and air with an epidural as well if you needed, but quite often you're so comfortable with an epidural you don't need the gas and air. But as this is a patient-controlled analgesia medication, you have control of how much you receive. It works quite quickly within the first few minutes as it goes through intravenous, so IV, into your vein. And it's as effective as a pethidine or a morphine, as it's part of the same opioid family. However, the risks associated with this is as it's part of the opioid family, it can cause nausea, drowsiness, or vomiting. It may provoke some itching or irritation. And the main thing is that it can cause temporary respiratory depression in yourself, so in the birthing woman or birthing person, which means it will slow your breathing. So this means we want to monitor your oxygen levels very, very closely. This might not happen, but it's just a risk, so we need to make sure we're prepared to keep you safe and monitor this really closely. The effects on baby are similar to pethidine, like I said, in terms of drowsiness. So, in summary, the non-pharmacological pain relief methods you can use in your labour and birth include a TENS machine, but you would need to self-organise this, the use of water, our alternative complementary therapies, which you would need to self-organise. Our pharmacological pain relief methods include paracetamol, codeine, Oromorph, gas and air or Entonox, pethidine, epidural, and remifentanil. So now we've discussed all the different types of pain relief methods that are available to you during your labour and birth. it's really important to think about what you would like to use. So, the BRAIN tool you might have heard of already. It stands for benefits, risks, alternatives, instinct, and nothing. BRAIN. This is a really good tool to aid your decision making ahead of your labour and birth, but also in the moment as well. So it's a way to aid your thought process. So if you're proposed with a pain relief option, you can think, what is the benefits to me of this option? Are there any risks associated with it for me or my baby? Are there any alternatives that I might prefer? What does my instinct tell me? So what is my gut telling me? And what happens if I just say no or choose nothing? There's a link on this page that talks about personalising your care, and the QR code takes you to that page as well. This page on our website is all about informed decision making and how to make your care really personalised to you. To end with, I would like to show you again our Labour Pains website. This Labour Pains website has lots of different resources available to you to look at in terms of pain relief in your labour and your birth. Pain relief for vaginal births, pain relief for caesarean births. It also has a comparison chart which you can look at as a one-page document to look at all the different available pain relief methods to you, and you can compare them, the risks and the benefits of them on one page. Please use the links to the Labour Pains websites after this session to help aid your decision making. Finally, as you're watching this session, have a little look where you fall on this pregnancy journey. Think about what things you need to start looking into in terms of pregnancy information and planning your labour and birth. If you want to scan the QR code in the corner, that will take you to our SASH antenatal classes Eventbrite booking page, so you can book on to any further antenatal education classes.
Thank you for watching. Any feedback you have on this virtual session would be greatly appreciated so we can continue to improve our Hello Baby classes. Thank you.